next speaker is Dr. Riccardo Stanzani from Italy. His topic is correlation between CFD and intraoperative findings in unruptured MCA bifurcation aneurysms. So please, Riccardo, you can start your topic.
Yes. Thank you. I'm trying to share my screen. Okay, can you see?
Yes, it's good.
Okay. Thank you, everybody. Good morning, and thank you for joining this meeting. My name is Riccardo Stanzani, and I'm a fifth-year resident in neurosurgery from Italy, and a previous Professor Cato Fellow, whom I thank for the kind invitation. Today, as Alberto told to us, I want to talk with you about the correlation between computational fluid dynamics, CFD, and intraoperative findings in unruptured MCA bifurcation aneurysm. With CFD software, after building a computational volumetric mesh from CT angio images, we can run algorithms that use the Navier-Stokes equation to simulate blood flow on the computational mesh. In this way, we can obtain different parameters: the pressure at the aneurysm wall, the pressure variation at the aneurysm wall, the wall shear stress, the OS index, and the vector diversification. On PubMed, we can find a lot of papers about CFD and intracranial aneurysm, most of them trying to correlate the CFD parameters and the aneurysm risk of rupture. But as we well know, aneurysm risk of rupture may also be influenced by other factors, like, for example, genetics and personal risk factors. So the role of CFD to define the aneurysm risk of rupture is still not clear at all. At the same time, some authors investigate the potential ability of CFD to provide information about the structural characteristic of the aneurysm, and that can be a very valuable tool during the treatment of aneurysm, both surgical and endovascular treatment. We all know that intraoperative we can find the three kinds of walls: thin red wall, like this one, a normal wall, and a thick atherosclerotic wall. So what we think? We think that a thin red wall is related with medium high pressure and pressure variation, a diversification of vector, an higher OS index, and a lower WSS. In a normal wall, we can find a medium or medium-low pressure and pressure variation, parallel vector, lower OS index, and medium-high WSS. In a thick atherosclerotic wall, we can find a medium-low pressure, convergent vector like this, higher OS index, and medium WSS. To verify our hypothesis, we analyzed unruptured MCA bifurcation aneurysm treated from January 2019 to December 2019 at Neurosurgical Department of Fujita Health University, Bantane Hospital in Nagoya, Japan. We reviewed the intraoperative video and checked the CFD analysis and parameters of 21 patients with 21 aneurysms. We identified 30 areas of interest. 14 are thin red wall, 12 are normal wall, and 4 are thick atherosclerotic wall. For each one, we evaluated the following CFD parameters: pressure, pressure variation, WSS, OS index, and vector diversification. I don't know why this blue one, sorry. Okay. And we can see here the average of the parameters collected for each kind of wall. We can see that thin red wall has a higher pressure and pressure variation and lower WSS. We can see also that the thick atherosclerotic wall has the higher value of medium value of OS index and a different partner of vector diversification for each group. We perform a statistical analysis and we use the t-test for the comparison of mean values for continuous data and the Fisher exact test for the comparison of categorical data. we can see that we found an higher pressure variation that significantly correlates with the red thin wall. At the same time, an high OS index significantly correlates with the red thin wall and thick atherosclerotic wall. Divergent vector significantly correlate with the red thin wall, and the convergent vector significantly correlate with thick atherosclerotic wall. So we can say that in our series, in our experience, an high pressure variation, an high OS index, and a divergent vectors significantly correlate with the intraoperative finding of a thin red wall. And a high OS index with convergent vectors correlate with thick atherosclerotic wall. Thank you for your attention.
Thank you, Riccardo, for this nice presentation. Is there any question by participants of this meeting? Otherwise, I have a question.
Yeah.
Of course, CFD is very intriguing method to try to predict how an aneurysm will behave over time. And there are some contrasting results in the literature, as we know.
That's true.
And probably also inflammation of the wall of the aneurysm is part of this process. So do you have any data, any experience, or any project in trying to match CFD data with histopathological findings on aneurysm walls?
There's something that introduced a colleague, an Indian colleague, Dr. Devaredi, that was in Nagoya when I was here, and is trying to correlate the CFD parameters with the histopathological findings by obtaining a portion of the aneurysm sac when we can cut the aneurysm during the surgery. It will be a long work because we need a high number of specimens, and not always you can cut the sac at the end of the surgery, but it's something that we want to do. We are trying to do this. And at the same time, I think that the results in the literature are not the same in the different centers, because there's too much software that we can use for obtaining CFD parameters, not only one software in the world. And at the same time, maybe there's something to do to obtain better algorithms with the Navier-Stokes equation. I think these two things are something that we have to work in the future.
Probably. Yeah, it's a very interesting technique, but probably many variables still.
Yeah.
Okay.
I agree.
So if there are no other questions, Arvind,